There was a moment, a single phone call, that changed Linda's financial life forever. Not because of a bad investment, not because of a scam, but because of something much more ordinary. A surgery. At first, it sounded routine, something doctors perform every day, the kind of procedure that millions of people go through without thinking twice. And when Linda scheduled it, she believed it would cost a few $1,000s at most. Maybe 5, maybe 10. Something manageable. Something she could pay with savings and move on. But 12 months later, Linda would open a stack of medical bills that added up to something shocking. $187,000. And most of it was her responsibility. Linda was 61 years old. She lived in a small house outside the city, the same house where she had raised 2 children, the same house she had finally finished paying off just 3 years earlier. For the first time in decades, she felt financially stable, not wealthy, but secure. She had about $200,000 saved for retirement, carefully accumulated over 35 years of work. Every paycheck, every bonus, every tax refund, a little bit set aside, slowly building the future she hoped to enjoy. Her plan was simple: work 4 more years, then retire. Nothing extravagant, just peace of mind. But life rarely follows financial plans. It started as a dull ache, low in her abdomen. At first, Linda ignored it. Most people do. She told herself it was probably stress, or maybe something she ate. But over the next few weeks, the pain slowly grew worse. Not unbearable, but persistent. The kind of discomfort that quietly follows you throughout the day. Eventually, her daughter convinced her to see a doctor. Just to check, she said. Linda agreed, mostly to stop the conversation. Because deep down, she didn't think it was anything serious. The doctor ordered a few tests, blood work, imaging scans, standard procedures. Linda wasn't worried. These things happen all the time. But when the results came back, the doctor's tone changed slightly. Not alarming, but more serious. There's something we should take a closer look at. He explained that she had a condition affecting her gallbladder. It wasn't unusual. In fact, it was one of the most common surgeries performed in the country. Gallbladder removal. A routine procedure. Thousands performed every week. Low risk. Short recovery. Linda felt relieved. Because routine procedures don't sound frightening. They sound manageable, predictable, safe. But that sense of safety would soon be tested. The surgeon explained the process calmly. The procedure itself would take about an hour. Most patients go home the same day. Recovery time is usually quick. Within a few weeks, people returned to normal life, Linda asked the question that felt most important. How much will it cost? The surgeon smiled politely. That depends on your insurance. And that answer seemed reasonable at the time, because most people assume insurance will cover routine medical care. After all, that's what insurance is for: protection from large medical expenses. So Linda contacted her insurance provider, and the representative confirmed something reassuring. Yes, the procedure was covered. Yes, the hospital was in network. Yes, her out-of-pocket cost would likely be limited. The representative estimated something around $6,000. Linda felt relieved. $6,000 wasn't cheap, but it was manageable, especially for something important to her health. So she scheduled the surgery. Hospitals have a strange atmosphere early in the morning. Quiet hallways, bright lights, nurses moving quickly between rooms. Linda arrived before sunrise, checked in, signed several forms. Most of them she barely read. Because when you're preparing for surgery, your focus isn't on paperwork. It's on the procedure itself, on getting through it safely. And within a few hours, Linda was in the operating room. The surgery began. At first, everything went according to plan. But halfway through the procedure, something unexpected happened. A complication. Rare, but not unheard of. The surgeon encountered internal bleeding. Suddenly, the simple 1-hour surgery became more complex. Additional staff were called into the operating room. More equipment. More time. What was supposed to be a routine procedure extended into something far more complicated. And complications in medicine often create something else. Additional costs. Costs patients rarely think about in advance. Instead of going home the same day, Linda stayed in the hospital overnight. Doctors wanted to monitor her condition, just to be safe. At the time, that decision felt reassuring. Hospitals are supposed to be places of care, of protection. But each extra hour inside a hospital also adds something invisible. Charges, fees, specialist consultations, medications, equipment usage, room costs. Each item recorded carefully inside a billing system. Most patients never see those numbers until much later. And Linda was no exception. 3 weeks after the surgery, the first bill arrived. Linda expected it. She knew there would be expenses. But when she opened the envelope, she noticed something strange. The number looked higher than expected. Much higher. The total charge listed on the document was $32,000. Linda wasn't immediately worried, because medical bills often show the full charge before insurance adjustments. She assumed the insurance company would reduce it significantly. That's how the system usually works. So she waited. And a few weeks later, another letter arrived. this time from the insurance company. And what it revealed was something Linda had never fully understood before. The insurance statement listed every charge, every service, every item used during the procedure: operating room time, anesthesia, medications, lab work, imaging scans, recovery monitoring. But next to those charges, another column appeared: not fully covered. Some services were partially covered. Some required coinsurance. Some fell outside the plan's limits. Linda read the document slowly, trying to understand the numbers, because the total she owed was no longer $6,000. It was over $40,000, and that was only the beginning. Over the next 2 months, more envelopes arrived from different providers: the hospital, the anesthesiologist, the surgical assistant, the lab, the imaging center. Each one billed separately. Each one included different costs, different insurance adjustments, different balances owed. By the time Linda added them all together, the total charges had climbed past $100,000. And the amount she personally owed kept growing. One evening, Linda sat at her kitchen table with a calculator. Stacks of medical bills spread around her. She added the numbers carefully, double-checking each one, because the result seemed impossible. But the calculator showed the same total every time: $187,000. Nearly the entire amount she had saved for retirement, all connected to one surgery, one complication, one hospital stay. And at that moment, Linda realized something terrifying. The surgery that was supposed to protect her health had just destroyed her financial future. Linda sat at the kitchen table for nearly an hour. The calculator was still in her hand. The number on the screen hadn't changed: $187,000. She checked the bills again. Maybe she had counted something twice. Maybe one of the charges had already been paid by insurance. Maybe the numbers were temporary. But every document said the same thing: balance due, balance due, balance due. And suddenly, Linda realized something she had never truly understood before. Medical bills don't arrive all at once. They arrive slowly, piece by piece, until the total becomes overwhelming. The hardest part wasn't just the amount. It was understanding where the money was coming from. Because every bill looked different. Different provider, different service, different codes. Some bills showed original charges. Others showed negotiated insurance discounts. Others showed patient responsibility. And none of them explained the entire picture. Linda spent hours trying to make sense of it. But medical billing language is not designed for easy understanding. It's built around complex codes, insurance contracts, and billing systems most patients never see. which meant Linda was trying to solve a puzzle without all the pieces. The next morning, Linda started making phone calls. First, the hospital billing department. After 20 minutes on hold, a representative finally answered. Linda explained the situation. She described the surgery, the unexpected complication, the growing stack of bills. The representative listened patiently. Then she said something Linda didn't expect. That's actually not unusual. Not unusual. Those two words stayed in Linda's mind. Because losing nearly $200,000 didn't feel normal. But according to the billing department, cases like hers happened more often than people realize. The representative began explaining some of the charges. Operating room time, specialist consultations, emergency monitoring, extra medications, additional imaging scans. Each service carried its own cost. And when complications occur during surgery, those services multiply quickly. Every extra minute in the operating room increases expenses. Every additional specialist adds another bill. Every extra test generates another charge. Linda listened quietly, trying to process what she was hearing. Because the surgery itself wasn't the only expense. The complication had triggered an entire chain of medical services, each one necessary, each one expensive. Then came another explanation, something Linda had never heard before. Her insurance policy included something called coinsurance, which meant that even after insurance paid its portion, Linda was still responsible for a percentage of the remaining costs. In her case, that percentage was 20%, and 20% of a large medical bill can still be an enormous number, especially when multiple providers are involved. Linda did the math quickly in her head. 20% of nearly $200,000. Her chest tightened slightly, because suddenly, the numbers made sense, and that understanding made them even harder to accept. But the biggest shock came later. During another phone call with the insurance company, the representative mentioned something Linda had never considered. One of the specialists involved in the surgery was not part of her insurance network, even though the hospital was in network, even though the surgeon was in network. One of the doctors assisting during the complication was not. That meant his services were billed at a completely different rate, a much higher rate, and insurance covered far less of it. Linda stared at the document while the representative explained it. The specialist's bill alone was more than $30,000, and most of that cost was now Linda's responsibility. That was the moment Linda truly understood something important. Even when you carefully choose an in-network hospital and an in-network surgeon, other providers involved in your care may not be in-network. And during an emergency situation inside surgery, patients have absolutely no control over which doctors are called into the room. The system makes those decisions automatically, but the bills still arrive in the patient's mailbox. Over the next few weeks, Linda's life began to change. The bills sat in a neat stack on her kitchen counter. Every time she walked past them, she felt a knot in her stomach. She began waking up earlier than usual, sometimes at 3 or 4 in the morning, her mind replaying the same questions. How will I pay this? What happens if I can't? Will they take my house? Will this destroy my retirement? Financial stress has a strange effect on people. It quietly follows you everywhere, even during ordinary moments. Eventually, Linda contacted the hospital again, this time asking about payment options. The billing department offered something called a payment plan. Monthly installments, spread across several years. At first, that sounded helpful, until Linda calculated the numbers. Even with a long payment schedule, the monthly payment would be more than her mortgage used to be, and Linda had already paid off her house. The idea of taking on a debt larger than her old mortgage felt overwhelming. Linda eventually spoke with a financial advisor, someone recommended by a friend. She brought all the bills with her, every statement, every insurance document, every charge. The advisor studied the papers carefully. Then he looked at Linda and said something honest. This is going to be difficult. Not impossible, but difficult. Because medical debt operates differently from most other types of debt. Hospitals can send unpaid balances to collections. Collections affect credit scores. And large debts can create legal pressure over time. Linda felt a wave of exhaustion wash over her. Because she had spent decades avoiding debt, working carefully, saving responsibly, and now, one surgery had pushed her into the most serious financial situation of her life. A few weeks later, Linda made a decision she never expected to make. She withdrew money from her retirement savings. Not all of it, but a large portion, nearly $100,000. The money she had carefully saved for decades. Money meant to support her later years, now being used to reduce a mountain of medical bills. When the transfer finally cleared, Linda sat quietly at her kitchen table, looking at her retirement account balance. It had been cut in half, and that realization carried a deep emotional weight, because the surgery had fixed her health problem. But it had created a completely different problem, a financial one. For months afterward, Linda kept asking herself the same question. How could something so common create such massive financial damage? Gallbladder surgery happens every day, thousands of times. And yet, in her case, the costs had spiraled beyond anything she imagined. Eventually, she learned the answer, and that answer revealed something important about the healthcare system, something many people only discover after it's too late. The real danger wasn't the surgery itself. It was the unpredictability of medical complications. Because medical costs are often estimated based on routine procedures, best-case scenarios, standard recoveries. But complications introduce an entirely different financial reality. Extra specialists, extra time, extra care, and every additional service creates another bill, which means the final cost of a medical procedure can be vastly different from the estimate patients receive beforehand. Over time, Linda slowly adjusted to her new financial reality. She changed her retirement plans, decided to work longer, cut back on some expenses, and rebuilt her savings little by little. It wasn't the future she had originally imagined, but it was still a future she could manage. And eventually, she began sharing her story with friends, not to frighten them, but to help them understand something she wished she had known earlier. Because the biggest financial risks in life aren't always the ones people expect. Months passed. Slowly, life began to return to something that looked normal. Linda's health improved. The surgery had worked. The pain that once followed her every day was finally gone. But the financial consequences of that surgery remained. Every month, another payment left her bank account. Money that once belonged to her retirement savings. Money that had taken decades to build. Now disappearing much faster than it had ever grown. And that reality forced Linda to confront something she had never considered before. The true cost of healthcare isn't always measured in recovery time. Sometimes, it's measured in years of financial consequences. Before the surgery, Linda had a clear vision for her future. She planned to retire at 65, travel a little, spend more time with her grandchildren, maybe take a few road trips. Nothing extravagant, just simple freedom. But after the medical bills arrived, that plan quietly disappeared because her savings had been cut almost in half, and half a retirement fund cannot support the same lifestyle. So Linda made a difficult decision. She postponed retirement, not by a few months, but by several years. The future she once expected at 65 would now have to wait until 70, maybe even longer. Losing money doesn't always feel like losing money. Sometimes it feels like losing time, because every dollar in a retirement account represents something deeper. Hours worked, days sacrificed, years of discipline. For Linda, that $200,000 wasn't just a number. It was 35 years of early mornings, 35 years of commuting to work, 35 years of choosing to save instead of spend, and watching a large portion of that disappear in less than a year was emotionally exhausting. Not because she regretted the surgery, but because she never imagined healthcare could create that level of financial damage. Over time, Linda began researching the healthcare system more deeply, trying to understand the rules that had created her situation. And what she discovered surprised her. Many patients assume insurance protects them from catastrophic costs. But insurance policies are often more complicated than people realize. Deductibles, coinsurance, out-of-network charges, annual limits, billing structures. All of these details exist inside policy documents most people never read, not because they are careless, but because those documents are incredibly complex. And most people don't fully understand them until they face a major medical event. If Linda could go back in time, there are 3 things she wishes someone had told her before that surgery. Not to avoid it. The surgery was necessary, but to understand the financial risks more clearly. The first thing involves asking detailed cost questions. Most patients ask one simple question: how much will this cost? But the better question is more specific. What is the total estimated cost if complications occur? What specialists might be involved? And will every one of them be in my insurance network? Those questions feel uncomfortable, but they can reveal important information before a procedure begins. The second lesson involves verifying every provider involved in care. Hospitals often bring in multiple specialists during surgery: anesthesiologists, assistants, emergency consultants. And those providers may operate under different insurance agreements, even if the hospital itself is in network. That's how surprise medical bills often happen. Not through the main surgeon, but through additional providers patients never meet beforehand. The third lesson Linda discovered was about financial preparation. Medical emergencies are one of the most unpredictable expenses in life, which is why financial planners often recommend emergency funds, not just for car repairs or home maintenance, but for healthcare costs that insurance may not fully cover. Because even a well-designed insurance plan cannot eliminate every possible expense. And understanding that reality can help people prepare for situations they hope never happen. Despite everything that happened, Linda refused to give up on her financial future. She continued working, saved what she could, rebuilt her retirement fund slowly. It wasn't easy, and the progress felt slower than before. But progress still mattered. Because financial recovery, like physical recovery, takes time. Years later, her savings began to grow again. Not as quickly as she once hoped, but enough to restore some confidence about the future. There's something interesting about difficult experiences. They reveal strengths people didn't know they had. At first, Linda felt overwhelmed by the bills, the uncertainty, the financial pressure. But over time, she adapted. She learned new financial strategies, became more informed about healthcare systems, more careful about financial planning, and those lessons became something she shared with others. Friends, family members, coworkers approaching retirement. Not because she enjoyed talking about the experience, but because she hoped her story might help someone else avoid the same situation. One evening, Linda's daughter asked a question that stayed with her. "Do you regret having the surgery?" Linda thought about it for a moment. Then she shook her head. "No," she said quietly. "The surgery fixed the health problem." And that was true. Her quality of life had improved. The pain was gone. She could move freely again, enjoy everyday activities without discomfort. Health matters, sometimes more than money. But Linda added something else after a pause. I just wish I had understood the financial side better. Because the surgery itself wasn't the mistake. The lack of financial transparency was the problem. And that's something millions of patients face every year. Linda's experience is not unusual. Across the country, millions of people encounter unexpected medical bills every year, sometimes from emergency procedures, sometimes from routine treatments that become more complicated, and sometimes simply from the complexity of insurance systems. Most people never imagine these situations will happen to them. Until they do. Because medical events rarely arrive with financial warnings. They arrive suddenly, unexpectedly, and often during moments when patients are focused entirely on their health, not on billing codes or insurance clauses. Today, when Linda looks back on that year, she remembers two very different stories happening at the same time. One was about health, a surgery that solved a painful problem. The other was about finances, a series of medical bills that reshaped her retirement plans. Both stories began on the same morning, inside the same hospital, during the same procedure, and together, they revealed something important. Because some of the biggest financial events in our lives aren't caused by bad investments or risky decisions. They're caused by ordinary moments, routine procedures, unexpected complications, situations that seem completely normal at the beginning, until the final numbers arrive. Linda still keeps the very first medical bill she received, folded neatly inside a drawer, not as a reminder of anger or regret, but as a reminder of something simpler. How quickly life can change. Because the surgery that morning was supposed to solve one problem. And it did. But it also created another. One that took years to repair. And that's the quiet lesson hidden inside Linda's story. Because sometimes, the most expensive moments in life don't feel dramatic at all when they begin. They feel routine. They feel ordinary. They feel like just another appointment on the calendar. Until months later, when the final bill arrives, and the true cost becomes impossible to ignore.